I'm not feeling too good. Who can tell me what's wrong?
I need my allergy shots. Who can give them to me?
Do I have the cold, or could it be the flu?
I think I broke my hand. What do I need to do?
Where do I go?
The answer is the same for all of these questions. You go to the Student Health Services right here on the UTC campus. It's easy to find. Health Services is right across from the University Center or the UC in the McClellan Gymnasium in room 205.
Very, very easy. It's right beside the UC, just 30, 40 steps away from where you're going to be eating lunch and dinner and all that, so it is not hard to find at all.
The students can be sick as a dog. They've been asleep all day and it's 4:30 and their roommate just found them and they bring them over. Or they can be coming in for regular allergy shots, or they can come in for a well woman visit and not be sick. So we see them at all stages of health.
SHS is staffed by nurse practitioners to provide primary health services to students, faculty, and staff. Services include treatment for acute and chronic illnesses, physical exams, screenings, immunizations, lab services, TB skin testing, and allergy shots.
We have over 60 students that get regular allergy shots here. They, a lot of times their allergist is in Memphis or Knoxville or Nashville, and they don't want to go home every week to get an allergy shot. So we've always offered that service here.
One of the most common misconceptions I found regarding student health is the idea that in student health we only treat a certain type of patient. In particular, we only see sore throats or urinary tract infections, when nothing can be further from the truth. In fact, we offer a wide range of services to meet most any acute care need that you have, and we help manage many chronic illnesses as well. And we've made referrals to outside providers for cardiology, endocrinology, rheumatology, gynecology, gastroenterology, and even general surgery. And we, in student health, can manage wound repair, including suturing, stapling. We test for and treat for illnesses such as the flu, strep throat, urinary tract infections, sexually transmitted infections, sinusitis, ear infections, eye infections. We also do physicals for many of the departments on campus. However, we do realize that we are limited in some aspects, so there's some things we simply can't manage in this environment. However, our philosophy or motto, if you will, is that it's never okay to say, oh, we don't take care of that. It's rather we say, we may not manage that here, but we'll get you to the provider that does. So that way the students' healthcare needs are still met.
I went in and had a examination done, and Tim wasn't exactly sure. He wasn't sure about what was going on, so he referred me over to get an ultrasound done. The ultrasound was done the next day. I didn't have to worry about any of the appointment making or anything. They just told me where to go, even gave me directions and a piece of paper on how to get there. After getting there, they took care of all that, and I came in a couple days later. They had the results, again referred me to a surgeon. I didn't have to do anything that had to do with appointment making there. Headed to the surgeon, again everything was taken care of. They just gave me the appointment, gave me directions on how to get to his suite, on how to get to the place in Erlanger, where to park at Erlanger, just the whole 9 yards.
We do not bill insurance at SHS, but you still need to bring your insurance card and information with you each time you visit. We keep your insurance information on file to submit with lab testing or referrals.
Your appointment is free, and so that is covered with your student health fee. Now, I always tell people to plan on making payment when you come to student health, and you can do that either through cash, check, or your MOX card with your campus points. And the reason I say that is that some of the testing we do in-house, say if we do a flu test or a strep test, or if we give you an injection or provide you with medication or some medical supplies while you're here, you do incur a cost at that time for that service. And that cost, though, is simply based on the cost of the clinic. Bring your insurance information for a scenario where you might need a referral. That way we have it on file, and if we refer you out, we already have that information available. Or if we draw labs that we're going to send out, that will be billed directly to your insurance. But that comes from the lab company themselves. They'll bill the insurance.
You can also purchase student health insurance through UnitedHealthcare. Details on the coverage can be found under the Student Health Services on the utc.edu website. Every effort is made to see patients as soon as possible.
We always recommend appointments if possible. Now, we take walk-in patients on a daily basis. However, especially during the busier times of the year, we fill up very quickly. We only have so many time slots available during the day for each provider. But if you come to Student Health and you need an appointment, we can't see you that day, we'll offer you the option to see a nurse and be triaged. Now, based on that triage from the nurse, then we make further recommendations, whether it's okay to make the appointment the next available time, whether it's within the 24-hour period or not.
Our office hours are Monday through Friday, 8 a.m. until 5 p.m. Be sure to have your insurance card, your MOX ID card, and information about your medical history. You will also need to bring any medication that you are currently taking.
And I do want to stress that at no point, if you're ever found to have an urgent or emergent need, that you'll be turned away from Student Health. utc.edu/Student Health Services. Go to our webpage there, and at the very top of that page, there's a portal that just says Log In to Student Health. You click on that, use your student ID information, and you can pick a time slot that's most convenient for you. You can fill out your medical history form at that point. We also ask that you kind of fill out the section that's specific to that appointment, if you can. That gives us kind of a better way that we know what to prepare for your visit. We have that information ahead of time.
I love being here. It's the most rewarding nursing job I've ever had. I love working with the students and helping them be healthy while they're here at school. Your college experience should be one of the most fun times in your life, and if we can help the students stay healthy so they can stay in class, get good grades, learn something, and learn some good health habits, that's very, very rewarding.
After I met Miss June the first time, I just felt very comfortable with her. So anytime I'm sick or need anything, I just kind of call them and like, I need to see Miss June, and they're like, okay, that's fine.
Some of them become like family, and they'll see me on campus and say, hi, Miss June. You probably don't recognize me because I was so sick the last time you saw me, but now I feel great.
Always so nice. You're their priority as soon as you walk in, like if you're sick, because I went there when I was sick, and they made sure that, I didn't have to drive anywhere to get my antibiotics. They had them there, they gave them to me there. They were very worried about me, so they didn't make me drive. They're very caring. Anytime you need anything, like Miss June even offered, if she was like, if I need to send someone to go get it for you and bring it back here before you leave, that's fine. But no, they offer everything, like strep tests. They even do TB tests, like everything.
So it's really interesting to watch them grow up and find their path in life and be part of that whole experience with them.
Our website also has a wealth of information about good health. You can find out more about building healthy relationships, body issues like eating disorders, body image, or overexercising. SHS is not open during the evening or weekend hours, and we do not provide emergency services during those times. For information about what you need to do, go to our website. Thank you for allowing Student Health Services to serve you for your medical needs. We hope you have a happy and healthy experience here on our campus.